Hi, in today's video, comments on Psych Meds by Psychiatrist, I'm going to talk about lithium. Before I do, just a quick reminder to view the disclosure or disclaimer video if you haven't already, and just a reminder as well that these are general information videos and not a substitute for personalized treatment directly from a physician. So, as I said, I want to talk about lithium today. Lithium is an interesting medication in psychiatry. It's got a few different things that make it unique. It's largely held to be the best known medication because it's one of the oldest medications, one of the first medications used in psychiatry. It is used mainly as a mood stabilizer, so a medication to help prevent or treat mania in patients with bipolar disorder. It's also used as an add-on for treating depression. It has very good antidepressant effects. The most interesting thing about lithium to me is that it can be specifically used to target suicidal thinking, which I always found to be, hard to wrap my mind around, that a medication can actually target certain kinds of thoughts, but it has reliably worked in this capacity throughout my career, and I think it's a great tool that we have in our arsenal. As I often will allude to, the side effects are often dose related. So there are some important side effects to consider, which I will get into, but I want to emphasize that dosing matters. So for mood stabilization, you do need to use relatively high ranges, and you follow those levels by doing blood tests to check blood levels, and you're trying to stay in a certain range, and that is on the higher side where you can risk the side effects. But for add-on treatment for depression and for targeting suicidal thoughts, you're actually using what we consider a low dose, a low enough dose where you don't even actually have to monitor blood levels because it's low enough where you're essentially not at risk of having any problems with lithium. And then sticking with the uses, also in recent years, there's been some information that lithium can have some cognitive protective effects. So at quite low doses, some people are advocating that it can slow the onset of various kinds of dementia. Now, I don't prescribe it for those purposes, as that is not considered sort of an FDA-approved use of lithium, but I just wanted to add that in, that sometimes lithium may be talked about. You may hear about it in this capacity, and that's an even lower dosing level than even what I was talking about. These dose levels are available over the counter, whereas for the other uses, you do need a prescription to get lithium. So the dose range that it's generally prescribed in for mood stabilization is going to be 900 and higher, 900 to maybe 2400 milligrams. Again, you follow blood levels to kind of set that dose. I start out at 900 and then work up from there by checking levels. But for add-on for depression, generally it's 300 milligrams, maybe 600 milligrams. And likewise for targeting suicidal thoughts, I start at 300 milligrams and will go as high as 600 milligrams. And again, at those dose ranges, I don't check blood levels. When you're coming off, lithium is actually very efficiently excreted by the kidneys. So coming off of it is really not a process. I mean, if you miss a day's dose, your body's basically going to clear it out. You're not going to have meaningful levels after just a few days. Technically, it's about 5 days to clear your system, but it comes out pretty significantly even after just missing a day or two. And when you're deciding to stop it, you can just stop it, whatever the dose is. There's no taper required. And finally, the side effects. So when you're at the higher dose ranges, it can damage your kidneys and it can damage your thyroid gland. So those are two things that are followed very closely for any patient that's on lithium. I think if you're very good about maintaining a stable dose, you can avoid kidney damage, but the levels do fluctuate based on hydration, based on how much you're, excreting, your activity level. So it can be challenging to maintain a very stable level. So many patients will develop some level of kidney damage over the years, and it's one of the biggest problems with prescribing lithium is kind of maintaining kidney health. It can be done, and for some patients, as with all medications, the benefits justify the risks. For some patients, the lithium can be life-changing in maintaining stable mood. Fortunately, for depression and for suicidality, we don't have to worry about those kidney effects because, the dosing is low enough. When you get lithium toxic, when you go above those levels, in addition to damaging the kidneys over time, acutely you can get blurred vision, you can get problems walking. It's pretty obvious when somebody becomes lithium toxic, sort of like acutely. So again, generally those things are thought about and steps are taken to prevent those things from happening, but those are the main kind of side effects, is watching out for the kidneys, the thyroid gland, and some of the effects that I alluded to. And then another side effect that I just remembered, some patients develop something called diabetes insipidus, where they end up, the lithium triggers the impulse to drink copious amounts of water to the point where they are potentially causing themselves medical problems from drinking too much. And it's like an insatiable thirst that can be triggered by lithium, and I've seen that happen to certain patients. So it is or can be a very tricky drug for certain patients, but it can also be life-saving for other patients. So if there's something that I missed, please feel free to comment on the video, and I'll do my best to address it. Thank you.